Okay, we are back again, Ashley and Christy again. Now we're going to talk about something that you may or may not see. We do have a sim that involves this piece of equipment, so I do want to kind of go over it so that you know what it looks like and what it does and what to ask for when the patient has a concern or complaint. So I'm just going to kind of role play here, and I'm going to talk to my patient about how she's feeling on the oxygen. Hi Ashley, I'm Christy. Just wanted to come and check on you and see how you're feeling on the oxygen. If you feel like you're getting it, you've been on 2 liters for a while now. So how is that feeling?
Yeah, it feels good. I just feel really dry, and I blew my nose and I was bleeding a little bit.
Oh.
And I don't usually get nosebleeds.
Okay. So sometimes because of the direct contact of the flow of the oxygen going right into that airway there, it dries out our mucous membranes right there, which can happen. So I can get you some humidification. Is that something you're interested in?
Oh yes, please.
Okay, great. So in this situation, typically you do not need a doctor's order to attach a humidifier to a patient's cannula, but I will always caution you and say check your facility's policy to make sure that that is actually legit. We're not giving them a medication on top of their medication of oxygen. We're just humidifying it so it's more comfortable. But like I said, just err with caution and make sure that you check to see if you do need a doctor's order to use this. So in the event your patient has a dry nose and we need to humidify the oxygen, we have to hook up what's called a bubbler. And really, it's what it is. It's a little humidifier, and they come in different colors, but typically they sort of look like this. I'm going to open this up for you. And so what you see here is a little canister for water, which is going to be just your regular distilled water is usually what goes in here. And so we open it up and we're going to put some water. It'll say like minimum and maximum so that when air is blown into this port, into this port and the oxygen is connected here, what will happen is the water is going to cause a bubble effect that's going to humidify the air that's going into her cannula. So I'm going to show you that. I'm going to pour some water in here, and really for the purpose of this sim, I'm just going to put some bottled water in here just to kind of prove the point. So I put my water in. It's up to the minimum line. I'm going to attach the lid, okay? And so now it's on. And now what happens is I'm going to turn the oxygen off for a brief second. I'm going to tell Ashley I'm going to turn your oxygen off for a second to connect this so you may not feel something come out of there. Okay. The next thing I'm going to do is I'm going to remove the little green Christmas tree that is on this flow meter. Okay, this little green thing. All right, and I'm going to remove that. Put this down. All right, so we don't need this piece when we're connected to this one. All right, and then this is going to go into the little port like so. All right, and then this is going to connect to the bottom of the oxygen flow meter, just like the little green Christmas tree was. So it's on, everything's connected. Again, I've checked the integrity of my oxygen tubing, and I'm gonna put her right back at the rate she was ordered on, which was 2 liters nasal cannula. So Ashley, I'm gonna turn your oxygen back on. All right, and when I do that, what it's doing is bubbling, okay? And over time, she'll start to feel a little bit more moisture in there so that she does not continue to get more dry with the constant flow of her nasal cannula. And then you want to make sure that you're watching this to make sure that, you know, the water eventually is going to it's going to disappear because it's going to evaporate over time. So you can ask RT. Usually they'll bring up some distilled water and they'll just refill this canister so that it's constantly got water in it to continue to humidify the air. Okay, so that is how you're going to humidify the cannula.